Joining us now to talk about it is Democratic Congresswoman DeGette, Chief Deputy Whip, and she is from Colorado. Congresswoman, thanks so much for your time today.
Good morning, Shannon.
All right, what did you make of the hearings this week? We had one in the House Ways and Means, also over in the Budget Committee, and more to come.
Well, what we have said is if there's ways we can fix the health care bill to make it better, we're willing to do that. But outright repeal, which is what the Republicans would do, would take away many benefits that Americans are already seeing. You can put your kids up to 26 on your insurance policy, no discrimination for gender. You can put your kids who have pre-existing conditions like asthma or diabetes on. So all of those things the Republicans voted to wipe out, and it's really kind of unclear to us what they plan to replace it with. If there's ways that we can agree on some fixes, like for example, taking away the tax burdens for reporting on small businesses, we're happy to do that, but we haven't seen that yet.
What is the mood among Democrats there on Capitol Hill as, you know, the GOP has succeeded in this repeal vote in the House. There's almost no chance, although anything can happen on Capitol Hill, that it will succeed in the Senate, and certainly not if it got to the president's desk. What's the mood among Democrats?
Well, we're kind of confused because we think that the #1 issue facing Americans is jobs. How do we create jobs? How do we bring the unemployment rate down? How do we keep jobs here in America? And 2 of the first 3 bills the Republicans have introduced have nothing to do with creating jobs, and they seem to be targeted at making political points with their base. So we're kind of perplexed about what the majority is trying to do, and we really think that we should spend some time thinking about how to create good jobs.
Well, one of the key witnesses this week, at least before the Budget Committee, was Rick Foster, who is the chief actuary for Medicare and Medicaid. Republicans seemed buoyed by what he had to say as far as the cost impact of health care and what it would mean. He was asked, does this bill, as it currently stands, fulfill the promise to lower health care costs for Americans? And he said, I would say false as to that. I mean, this is the numbers guy. How do you respond to his testimony?
Well, of course, the nonpartisan Congressional Budget Office says if you completely repeal the bill, then what you will do is have a $230 billion hit to our deficit over the next few years. So people can have different opinions. I think we can do more to save more money with the health care bill, but we need to make sure that we do it in a way that protects Americans' rights to buy health care insurance that will be affordable, and also protects the rights of seniors to have affordable and high quality health care. And that's really the rub. You can really reduce benefits for seniors in a very draconian way and save a lot of money, but you're not going to give seniors the kind of high quality health care they need. So certainly we need to look at these programs to see if we can get savings, but we need to be careful that we're not just cutting people's ability to get high quality health care.
All right, speaking of savings, let's turn to the issue of debt and deficit. You know, you have things like the debt ceiling, the debt limit being reached very shortly, an impending vote on that. The continuing resolution is going to expire around that same time. A lot of fiscal issues to tackle. Both sides have said there have to be sacrifices, there have to be cuts. Do you think that there will be some common ground?
Shannon, I've got to tell you, we're all concerned about the deficit, and we're concerned about restoring our economy. But I think there are some different approaches. We don't want to just see a huge cut that might cut jobs. For example, some of the cuts that the Republican study group has proposed would cut jobs of teachers, firefighters, police officers in states. They are so draconian that a lot of people would lose their jobs. And so the first thing is, in my opinion, we can't take anything off the table. If you just cut domestic discretionary spending, you can't have enough cuts to balance the budget. So we need to look at the military, and is there excess and is there waste in the military? We need to look at agricultural subsidies, and we need to look at the recommendations of the President's bipartisan commission to see if there are some adjustments that we can make to some of the entitlement programs. If you made minor adjustments right now to future beneficiaries, not current beneficiaries, then you could really see some great savings down the road without really impacting anybody that much.
All right, Congresswoman DeGette, we thank you for your time today. Good to see you.
So great to be on. Thanks, Shannon.